White Petroleum Jelly topical skin protectants can be used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. This product helps to soften and moisturize the skin, decrease itching and flaking, and protect the skin against irritation, especially from wetness. Dry skin is caused by a loss of water in the upper layer of the skin, and using white petroleum jelly can help trap water in the skin by forming an oily layer on the top of the skin. This product contains common emollients such as petrolatum, lanolin, mineral oil, and dimethicone, as well as humectants like glycerin, lecithin, and propylene glycol to draw water into the outer layer of skin. It also includes ingredients that soften the top layer of skin cells and help the dead skin cells fall off, leaving the skin feeling smoother and softer. For optimal results, apply a thin layer of white petroleum jelly to the affected area as needed, especially after bathing or showering. Make sure to use this product as directed, and some products may need to be shaken before use, so be sure to check the label. You can apply it to the affected areas of the skin as needed, depending on the product and your skin condition. For example, if you have dry hands, you may need to use the product every time you wash your hands throughout the day. If you're using this product to treat diaper rash, make sure to clean the diaper area well before applying the product. And if you're using it to help treat radiation skin burns, check with your radiation personnel first. It's important to follow all the directions on the label for proper use, and to only apply it to the skin. Avoid sensitive areas like your eyes, mouth, nose, and vaginal/groin area, unless directed otherwise. If you have any questions about where to apply the product, consult your doctor or pharmacist for more details. For the best results, use this medication regularly and apply it after bathing or showering while the skin is still damp. And if your skin is very dry, your doctor may instruct you to soak the area before using the product. Keep in mind that long, hot, or frequent bathing or washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, be sure to seek medical help right away. Using white petroleum jelly as a topical skin protectant is generally safe and effective, with minimal side effects. However, you may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication, it means that they have determined the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. Contact your doctor immediately if you notice any unusual changes in your skin, such as turning white, soft, or soggy from excessive wetness or signs of a skin infection. While serious allergic reactions to this medication are rare, seek medical help right away if you experience symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of potential side effects. If you notice any other effects not mentioned here, it's best to consult your doctor or pharmacist. Remember, if you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor or report side effects to Health Canada at 1-866-234-2345. Before using this product, it's important to let your doctor or pharmacist know if you have any allergies to the ingredients in the product. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. If you have any skin cuts, infections, or sores, it's best to consult your doctor or pharmacist before using this product. Some of the ingredients in the product, such as preservatives or fragrance, may make you more sensitive to the sun. Make sure to check the label for any warnings, and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may suggest that you limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. For those with acne-prone skin, it's important to look for the word non-comedogenic on the label, which means the product will not clog pores. Some products may also stain or discolor clothing, so it's best to ask your doctor or pharmacist for more details. If you are pregnant or breastfeeding, it's important to consult your doctor before using this product. Additionally, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. When using White Petroleum Jelly topical skin protectants, it's important to be aware of any potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will ensure that you are using White Petroleum Jelly topical skin protectants safely and effectively. If this medication is swallowed, it can be harmful, especially if someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing. In this case, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. For U.S. residents, you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center for assistance. To help prevent dry skin, it's important to use lukewarm water when bathing, take baths/showers less often, such as every 1 to 2 days, keep baths/showers short, and use a humidifier when the air is very dry. There are various types of emollient products available, including those with fragrance or other ingredients that some people may be sensitive to. Emollients come in different forms such as oils, creams, lotions, or sprays. It's important to consult with your doctor or pharmacist to find the best product for you. If you forget to use this product at the regular time, use it as soon as you remember. Do not use extra product or use it more frequently than directed to make up for the missed dose. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep this product away from children and pets. Avoid storing the foam canister near high heat or an open flame, as it is under pressure. Do not puncture or burn the canister. Do not flush this product down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.